First tonight, we're taking a closer look at two bills in the Maine legislature, one that's been passed and another that's still in the works, both centered around cutting red tape to address some big issues in the state.
Before we get to Sam Olson in Bath, let's head to Caroline LaCour in Augusta. And Caroline, how will this bill help Maine's healthcare staffing shortage?
Hey, Zach and Chris. The bills discussed in public hearing today look to address workforce shortages in Maine's healthcare systems by looking towards foreign-trained doctors who might have their sights on working here in the state.
30% of the Maine's healthcare workforce is retiring in 10 years.
It's becoming abundantly clear that no field is safe from workforce shortages, including healthcare. Now legislation aims to fix that by making it easier for some people to work in healthcare careers here in Maine.
And at the same time, almost 1/4 of all physicians and physicians in training are U.S. or international medical graduates. So this is a really pertinent bill to that.
Two bills introduced in a joint public hearing Tuesday both look to support foreign-trained healthcare workers by helping them secure employment. If passed, one bill would implement educational opportunities through the Department of Labor, as well as create a financial loan assistance for qualifying graduates through the Finance Authority of Maine.
In addition, increasing the diversity of Maine's healthcare workforce will lead to better outcomes, particularly for underserved communities.
The legislation comes from recommendations given by a commission made up of lawmakers and healthcare professionals for how Maine can best support and transition foreign-trained physicians or other medical workers seeking opportunities here in Maine.
We believe the recommendations by the commission serve to make entry into practice possible, but still upholds the core principles of assuring competency by appropriate assessment and knowledge skills.
A second bill that was also inspired by those recommendations would fund and establish a sponsorship program, almost like a medical residency. If passed, 10 positions would be up for grabs by graduates who could serve understaffed areas in Maine.
It would ensure that foreign-trained physicians would meet all necessary requirements and competencies prior to licensure, while providing an environment where the individual could be supported.
There was overwhelming support for both bills at Tuesday's hearing, but some who testified did bring up concerns about some of the wording in the legislation and who would qualify for the programs.
Who prepared to work in the U.S. but went outside. So, for example, went to the Caribbean to access these funds. And I don't think that that was the intent of the commission.
Zach and Chris, now both of those bills are scheduled for a work session in the Joint Standing Committee on Health Insurance, Health Coverage Insurance, and Financial Services tomorrow.
All right, Caroline LaCour live in Augusta tonight. Thanks so much.